Sciatic is a terrible pain that can occur if there is dysfunction somewhere in the low back, in a muscle that's in the pelvic area, a rotation in the hip, rotation in the knee, or something going on in the tarsal area of the foot or an area in the lower part of the neck. Sciatic pain is kind of a misconception because people will refer to sciatica as some sort of disease, but it's actually not a disease or a complaint. It's like saying someone has lumbago, and lumbago is a description of low back pain. All that means is it's low back pain. Sciatic is a description of a pain pattern that can occur anywhere from the lower back to the toes. And commonly, the sciatic pain pattern can occur in the low back, go down through the glute muscle, down the back of the leg, and then when it reaches the knee, it can continue down the back of the calf into the foot, or it can go down the side of the calf area. Sciatic pain is terrible. It's what we call a nerve pain, and it's no different than going to the dentist and having dental work and having that cavity or that drill hit a nerve. It's a terrible, terrible pain. If you've ever met someone who's experienced it, my heart goes out to them because it's a terrible pain. Can I help you with sciatic? And the answer is absolutely, maybe. Most likely what I do can help. The key factor in determining if what I do can help with what's going on with you, if it is true sciatic, is figuring out specifically where the cause of the sciatic is coming from. Is it coming from the low back? Is it coming from a rotation in the hip, which is pulling on a muscle called the piriformis muscle? Is it something rotated in the knee? Is it in the foot? Or is it a combination of all of those? Also, that pain can be caused by a dysfunction in the lower part of the neck, where the spinal tracts go down through the lower part of the neck, can get twisted by a neck dysfunction, causing the back to tighten up and causing imbalance in the low back area. So with chiropractic, I use a method called activator, which is using this tool to reset muscles, tendons, ligaments, and joints and return that area back to a normal function. Sciatic pain is terrible. It can go from what we call normal to worst. And a lot of times people think that the pain part of sciatic pain is the worst, but the worst part of it is when you have numbness. Numbness is much worse than pain, because pain is when that nerve is being affected, and then when that nerve flow is being almost completely cut off, that's when you're going to experience numbness. And that's a much worse situation. So when I work with people who have sciatic pain or who have already experiencing numbness, what I tell them is, if they say, oh, I've got numbness down in my leg or down the side of my leg or down into my calf area, as I say, once we start working on this, we're going to wake that nerve up, and that numbness most likely will turn into pain. And to not freak out, that is a normal thing, because you go from normal to stiffness, stiffness to pain, pain to radiating pain, and from radiating pain, you go to numbness. And when you experience numbness, that's when we really have a lot of work to do. And early in the video, I talked about saying, can I help with sciatic pain? And the answer is absolutely, maybe. And the reason I say that is sometimes that sciatic pain, when it occurs from a problem in the low back area, if there is a disc herniation, sometimes a surgical intervention is required. If it's a minor disc herniation, for example, like a disc bulge, a small disc bulge, then what I do can really help with that, because we can balance out all of these areas and allow natural healing to occur. If it's a more advanced disc herniation, not a bulge, but maybe a sequestered disc, then that definitely will require a surgical intervention. And that can be determined by doing an MRI. Most of the time when people come to see me, they've gone through a couple of steps. They've more than likely have had low back pain for a while, and then they've just lived with it, taken some medicine, and then start to experience maybe some pain or numbness down into the glute area, maybe down into the back leg. They've gone to their doctor has recommended them some muscle relaxants or anti-inflammatories. Maybe they've gone for further diagnostic testing, for example, an x-ray, or they may have gone for an MRI, some sort of scan, a dog scan, a cat scan, whatever kind of scan that they're going to go for. And then they come to me with a report. They've usually gone through a round of anti-inflammatories, painkillers, maybe have had some injections with maybe some relief, but the problem still reoccurs. And what I do, and why I'm so good at what I do, is because I will examine and I will check your body from the bottom to the top and check everything. I'm going to check the structure, which includes all the joints that are involved in what could be considered a sciatic problem, from the low back, the pelvis, the hip, the knee, the foot, the lower part of the neck. I will balance out all those areas. Then I will check the corresponding muscles, tendons, and ligaments. And that's really very important to do along with a chiropractic check. And then we can do further services if needed to get as much relief or cure the sciatic problem fully. One of the things that's really important is to know that when that numbness occurs, it's really at a point where it needs to be checked, because if you let that numbness go for a long time, that can start to affect your motor function. So the general check that I would do for someone that would come in with sciatic pain would be this. Someone would come in, we would talk about what's going on with them. I would get them to come up here onto the table. The table will preserve your weight-bearing posture. It will take you from a standing position to a lying position. Once this table is flat, the table will stop, and the foot piece down here will fall away from the feet. I use these special adjusting shoes. I'm going to get you to bend your knees. Shoe goes on one side, shoe goes on the other. As I talked about earlier, the important part is the structure of the body. The structure of the body will determine the function. If there is a problem with the structure, with the joints from anywhere from the ankles, the knees, the hips to the pelvis, and even the lower part of the neck, very important to understand that the lower part of the neck really will affect the low back, which can cause sciatic pain down one side or down both sides. So what I would do is I would check your spine from bottom to top, checking the leg lengths from one foot to the other, the ankles, the knees, the pelvis, and I would treat, using the activator, any areas that I would find. And that could be, from a sciatic point of view, a problem with the ankle. Again, with the knee, if there's a rotation in the lower part of the knee, can affect the stability of the pelvis. I would balance out the pelvic area, also check the hip. Really important to understand that sometimes there's a muscle called the piriformis muscle that can cause pinching on that sciatic nerve. And most importantly, check and balance out the lower part of the back. That's the area where the nerves come out and go down through the glute area, down the leg, down to the back of the calf, and down the sides, down into your foot. Also really important to do is to check and balance out the lower part of the neck, the upper part of the back, because that's where the spinal tracts, if they're affected, can twist and can cause an issue with the low back area. I would do that check and balance using the activator, and then I would come back and assess for trigger points. And that's really important to understand, because if there's dysfunction in the structure of the low back, it's going to show up in the gluteal area right through here. So I will balance out, check and balance out what we call the gluteal trigger points. I would also check all the supporting musculature down into the legs to find out if there are any trigger points, and I would treat them accordingly. Sciatic issues, because it's a complex situation, there can be many different causes for that sciatic pain. The treatment protocol for sciatic is generally a more detailed treatment program. So it's not something that will generally respond fully in 1 or 2 treatments. It can take up to 10, maybe 12 treatments to get relief in the sciatic issue. And then once we've gotten relief, when we've gotten the legs balanced out, the pelvic balanced out, then those areas need to heal, and that healing can take up to 16 weeks in a healthy person. So if someone would come to me on day 1 and we start treating for the sciatic, and I would recommend 10 treatments over 3 or 4 weeks, they've come to me, we've finished the treatments, the pain levels have diminished greatly. It's at that point that that 16 weeks starts. It's not from the first day of the treatments. Once the body is settled and balanced out, that's when that 16-week healing process will occur. Even though you're feeling better, we've got to really protect the area and allow it to heal fully. So once this treatment is done, patient will come back up off the table. Depending on how long you've been down on the table will depend on how many stops we make coming up. Because he's only been down for less than 10 minutes, we're only going to make 1 stop on the way up, and this allows the body to acclimate to being upright. And so let's say we've been in this position for 15 minutes, and we're going to come the rest of the way up. So sciatic is a complex condition that can have many different causative causes, and you have to really be able to understand the body and explore all these different possibilities to fully and completely address what could be the reason for that sciatic to occur. Good idea to rule out a more advanced disc herniation. Minor bulging disc is not that big of a deal as long as we can get everything stabilized and balanced. And then after that, it can take, like I said, 16 weeks for it to heal after we finish treatment here at the office.